Колеги, доброго дня. Ми продовжуємо робочий день. Мене звати
Continue our working day. I'm Valentin Pugachev, and today, in the framework of Spokesman of Peaceful Life project, we are going to speak about volunteer assistance to the hospitals of Luhansk and Donetsk regions from the charitable organization that is called Caritas Ukraine. This fund works for 25 years in Ukraine, and as of today, it has 20 regional offices and 12 regions of Ukraine. The general number is about 1,000 people employed. And Caritas Ukraine is focused on four main directions of activities. The first one is to work with children and youth. The next one is to work in healthcare, then social problems of IDPs, and help people in crisis situations. According to Statistics Department in Donetsk Oblast, from the start of the ATO, the number of medical institutions declined by half, and there were 164 hospitals, and next year only 75 hospitals were open. And the number of personnel declined to the third. And the number of hospitals was about 176 and now 27. The number of personnel also declined to the third part. And the number of hospitals declined, and medicines are lacking. So to improve the health and to the health of the residents of these oblasts. In this sphere, people are helped by the charitable foundation, and Semenchenko is going to tell us about this via Skype, and also Rostyslav Spryniuk, priest of the Ukrainian Greek Catholic Church charitable organization Caritas Ukraine, via Skype. Do you hear us well? Yes, we hear you well. This is our presenter, Irina Kadrova, who will be present on our program. We have simultaneous translation into English, so speak slowly. Maybe Roman will start. As of today, Caritas Ukraine Fund we help people who are in difficult social and material conditions, and also they have many chronic disease, and they are not able to provide medicines for themselves, and medical institutions are mainly absent in those areas where we provided vouchers for medical help, and medical help is restricted there. And in Marienka, there's only one polyclinic, and a hospital is destroyed, and there's no heating, and people are in difficult condition, and they are not able to provide those medicines for themselves and vitamins that they desperately need. So main diseases is heart disease, asthma, and also diabetes, oncology, and other conditions. And our function in this situation is to provide people with whom before this we provided some survey, and also we studied some medical documents, so we provide medical certificates for them, and for the amount of 4,000 hryvnias, and this is perfect in these conditions for the people. It is desperately needed by people. We should support them, and they can support their condition and improve it. And we also worked in Krasnogorovka, Mariinka, that are at the front line, and Chermalik, and people, they go that are close to Mariupol, Mariinka, Krasnogorovka. There are network of drugstores, and in Kurachiv also. And could you tell us, please, about the situation with the hospitals in Mariinka? Hospital is absent in Mariinka. Only partly there is a neurological department, and people are provided with some treatment in separate buildings that where there's heating. Only in Kurachovo there's in-hospital treatment, but there are this hospital is overcrowded, and it's very difficult to get proper help there. And they provide help to people out of hospital, help to people, and in polyclinics also. Could you tell us why is the main part of these medical institutions in these towns and villages, why are they out of operation? What is happening? What is going on? The situation is like this. In those settlements and towns that are in the ADU area, and before the conflict they were understaffed, and after this many doctors left, and many hospitals and medical institutions were closed, and Krasnogorovka facilities were destroyed. That's why hospital works only for several hours a day. And what about neighboring villages near Mariupol? There are some in-hospital treatment in Mariupol, and also they get help in polyclinics, and some and in Pavlopol medical unit is not in operation. Some people were captured, and they may be exchanged for some other people. And ambulance help is also restricted. That's why our help of the Red Cross is highly needed. Tell us about the program. And Caritas distributes some medical kits for population, and we provided a monitoring of the population, and we try to provide some heating facilities and also provide some medicines that are highly needed, antibiotics and iodine, cotton, and also sedative medicines and other important medicines that are needed for first aid. And tell us the number of people involved in this program of medical vouchers in Mariinka. we provided 23 people. And I thank to those doctors in Marinka Polyclinic that prepared a list of people, the most vulnerable group of people who needs this help. And this was a target help. And at Krasnogorovka, 23 people were provided with this support, and 4 people, due to there were some chronically ill people, cerebral palsy. So we help those people. Thank you very much. And now I give the floor to Rostyslav, and he will tell us about the program and what number of people is going to be provided with such an assistance. Thank you.
First of all, this program of Caritas Ukraine started thanks to our partners Caritas Austria and Austrian government, who sponsors the program. Now we start the program where donors, Caritas Germany will be a donor. In fact, the vouchers which we are distributing, which could be exchanged for specific methods, this is a pilot project. In future, we will provide much aid to people, but first we would like to assess the needs, because without the assessment, the people during the wartime, they try to take medicines even if they do not need them. Sometimes we should reject their requests, unfortunately. Roman and his assistant Bakhtan, and also psychological aid team works now. Caritas Austria is preparing a narrow, exclusively medical program, and more wider assistance will be provided in the form of glass in the buildings where the glasses have been destroyed. The vouchers could be distributed to 200 families, not more. Caritas of Ukraine would like to open large-scale medical programs inclusive of psychological aid module, because very many people are now experiences post-trauma periods and syndromes. The program will be designed for 2 years, so that Caritas Mariupol medical staff can maintain patients' treatment. This is not. This will not be a one-time aid. This would be regular aid. In Granitne, I met a woman who distributed her dose of insulinus for 6 parts. Now we have enough this medicine, but we can't supply, we can't distribute it because of problems with communications with the routes. Thank you very much. We visited Marinka and Krasnogorievka recently, and I would like to demonstrate you a video from the trip. Dear colleagues, please launch the video. I came for medical certificate we have some people who can't walk, so for those patients we help them. Now we can't buy medicines because we do not earn incomes due to the situation of hostilities, and also we have our houses destroyed. We experience hardships. 22 persons living in Krasnogorovka, most groups of patients. This is acute heart diseases, high pressure and strokes, and also oncology. So those patients who need very expensive medicines, and they do not have any opportunity to buy such medicines. And Caritas Ukraine, this is the only program helping them. When people experience hypertonia, depression, medical condition, depressive medical condition, or just some flu, we managed to help them because we received funding in the scope of this project, and we received free of charge medicines, and we provided these medicines free of charge to our patients. My diagnosis is phlegmona. This was their own diagnosis. My leg swell, my skin was necrotic, and but I experienced diabetes. Here I am provided with insulin medicines and syringes. This is a therapeutic department. It was the reanimation emergency room. We can't understand the message of this video because of the bad connection with you, internet connection. And now I would like to ask you several questions. The first question to Rostyslav: you told us about international cooperation with Caritas Austria, Caritas Germany, and you told about the project of medical vouchers, and also you told about the project of recovery of the houses, rebuilding of the houses. How you will assess the needs, and what is the probability level that you will launch this project? The situation is quite different. The needs are assessed by our medical staff who visit hospitals, ambulances, and village medical centers. They assess the urgent needs. They are our social workers. workers walk from house to house in villages and they assess the needs of the population, of the civilians. The assessment have already been completed, so we expect that within 2 or 3 months this medical project will be full-fledged in its implementation stage. The German project also will start soon. The second question, Irina asked you more narrower questions, and I have more philosophic question to both speakers. Why do you think your activities are needed? Why these activities are relevant for you? First of all, to do good to people, to make good to people. This is for public good and to save lives. Medical staff save lives, and we can see eyes of those mothers whose children experience diseases, and when they become happy, the children get their medicines, then we are happy too. Nobody will do that. The church is a charitable organization which is intended to bring hope to people, to work for public good. And Caritas is a charitable organization which goal is to bring hope that we will have not only medical assistance at the high level, but that we will have welfare and public good in our society in future. If we do not do that, then who will do that? I saw those people who received those vouchers, and all those people, they are patients suffering severe diseases, and their lives depend on those medicines which they can give thanks to vouchers. So most of them were crying when we granted them the vouchers. And for the parents who received those vouchers for their children, they also cried because they understood that they received the chance to save lives of their children. I hope that we will be heard by Ukrainian government. What statement, what message you would like to tell to the government today? We expect that the government can provide required medicines and equipment to those clinics which are still in operation in the east of Ukraine, and medicines for oncologic, diabetes diseases and other severe diseases should be supplied. And also the hospitals that have been destroyed, they should be restored, rebuilt as soon as possible. Our government should think how they can provide medical staff with high salaries in the East. I would like to say that looking into the buffer zone settlements, I would like to say that they are abandoned. The government is willing to do something, but as a result of the warfare, the government has no opportunity to help. More efforts should be put. We do not have ambulances. A person residing in a village near Mariupol, it has no opportunity to call an ambulance or to get to a hospital herself or himself. I have one medical staff, and he told me, who will treat us in a year or 2 years? Look, students they study in the medical institutes for money, so they do not have high qualifications, high competences. Only 20% they really learn how to deliver medical aid, and 80% they are not enough skillful. We have one more question. Sergei Malerchuk, Ukrainian Crisis Media Center. Thank you for your press briefing and for your work, for your activities in Luhansk and Donetsk region, for your help to the civilians who acutely need such help. Could you tell us, is there any difference between the time when the problems in those regions just started and today? Are there many volunteers working now? As governmental help increased in its amounts to the patients comparatively, as compared to the start of the warfare and today? Yes, the situation has changed for better, but unfortunately the changes for better in the supply of medicines to the patients experiencing severe conditions. All these supplies come from volunteers and charitable organizations, but not from the government, not from the state. Thank you, Irina. Thank you, Roman. Thank you, Rostislav. We hope to listen to you in future, to have more press briefings with you. Thank you, colleagues, for listening to us. Our next briefing under the UCMC pilot project spokesperson of peace